Greetings, I'm Jennifer Kennedy, the lead for Compliance and Quality at CHAP, and welcome to this edition of CHAPcast. Today, we're going to be talking about the calendar year 2026 Home Health Payment Update Rule, the sequel, but with just the DME provisions. And I'm so happy to be joined by my colleagues, Kim Skehan and Shannon Dorsey Dunlap. Kim, Kim and I have talked many times on many CHAPcasts, and Shannon is our Director of Accreditation with DME experience. So welcome, Kim and Shannon.
Thank you, Jennifer.
Thanks, Jennifer.
All right, so let's go ahead and jump in. This piece of the rule is really, I think, what took up most of all those 762 pages. And the tone in this section of the final rule really revolved around improving efficiency and validation that DME providers are compliant with regulatory requirements, all in the push to prevent fraud and abuse related to this DME space. So based on this tone and the themes, you're when we go over the content, you're gonna definitely feel this is really serious what they're trying to do in terms of reforming the DME space to cut down on that fraud and abuse. So what I'd like to do is jump in and talk about what the significant changes for DME providers are first, and there will be changes for accreditation organizations as well. But let's go ahead and talk about the DME provisions. And, Kim, if you want to lead this with Shannon, I think that would be great since you both are in the accreditation space of our organization.
Sure. Well, I can certainly kick it off and talk about the focus as it relates to survey and also us as an accrediting organization. Just to be clear, yes, CMS most definitely clarified additional oversight that and tightening of accreditation and survey responsibilities requirements for both providers and for the AOs. It appears as though some of these areas that were placed into the proposed rule for DME also stemmed in some fashion with the prior home health and hospice accrediting organization oversight proposed rule that is still, as far as I know, still pending. But seems as though they
still pending.
Yep. So they pulled some of that language. Although we have in communication with CMS, it's clear that these provisions, while they are similar, are not aligned specifically with what would be the expectations for the current or anticipated processes for home health and hospice. So they are treating home health and hospice, DME, separately. And you're right, the understanding is because there has been a long, many years with a lack of according to CMS, oversight, which has then in many cases, or in some cases, resulted in fraud. Although CMS has also increased audit oversight, they're also looking to the accrediting organizations to also, if you will, lay eyes on the agencies, the suppliers more frequently. To ensure compliance with regulations and making some of those penalties more stringent. We saw this information or this proposal, this information or these items in the proposed rule. But understanding now that they have all but a couple been finalized, all with overall effective dates of January 1st, 2026. So rapid turnaround, but there is a little bit of leeway that I think folks need to just understand. So what I'll do is I'll talk about I'll talk about the AO changes and the surveys. I would say, and Shannon, correct me if I'm wrong, the biggest challenge, or the one area that really, I guess, shocked, I would have to say, the supplier community, certainly as well as AOs, was the implementation of annual surveys, technically effective January 1st, 2026. That's been the number one comment, I think, that certainly we have heard, and I believe CMS also had heard. It's important to understand that CMS did clarify with the AOs last week that the annual is in effect as of January 1st, but will begin to be required with any new suppliers who are initially accredited, or anyone who's reaccredited at the time of their reaccreditation. Their 3-year reaccreditation would now become an annual accreditation. So, for example, if someone had a supplier had a triennial survey in 2025, they would not be due for their next survey until 2028, and at which time then they would transition to annual. Or if they were surveyed in 2024, it would be 2027. So I think that really helped relieve, I think, some of the concerns, certainly on the AO side, as we are gearing up to ensure that we have qualified staff, site visitors, but also for the suppliers as well. Because remember, DME is the one supplier, certainly that we accredit, that is required to be accredited. So accreditation is not an option for a DME supplier.
Kim, I can tell you, as an AO, I felt like shoo.
Yeah.
In terms of the implementation plan. I'm glad they sort of built that glide flight into the annuals, and that, I think, gives providers more time to sort of wrap their arms around what this is going to mean for them in terms of processes and costs and all of those things.
No, agreed. And I would also say that, it also gives us as an AO the time to make sure that we already have very well qualified DME site visitors, we call them surveyors, but to be able to, bolster our team, and then also ensure that there's a consistent understanding of the standards and the oversight processes. That's as the person, along with Shannon, who oversees the accreditation and survey process. That's extremely important. Jennifer, Shannon, can you just make a quick point about the elimination of the temporary accreditation? Because I do think that that's an important area that suppliers need to understand, and providers.
Absolutely. So currently, an AO may accredit a new location for an existing DME supplier for 3 months after it's operational without requiring a new site visit. So what we would do is, once we're notified that an already accredited organization, adds a new location, we go ahead and extend accreditation, and then we conduct a site visit within 90 days. However, effective January 1, all DME suppliers must be surveyed before being accredited, so CMS can confirm that the location meets the standards. So yes, that is a big change.
Yeah, absolutely. And the other really is related to the CHOW, the change in ownership or majority ownership, which is, I'm going to use the term similar to the 36-month rule that we see in home health and hospice. And so organizations need to understand, or suppliers, if they have a majority ownership change, they would actually be surveyed as an initial certification, not unless they meet one of the exemptions that's in the rule. And that this is important, because if a supplier is then surveyed as an initial, they then become subject to the annual survey review, survey timeline and accreditation timeline from there forward. So I think that's an important note. Did I say that correctly?
You did. Yes, you did.
Yeah. So, can you, Shannon, can you just talk about the prior authorization process?
Yes, so there is a proposed exemption process for prior authorizations. CMS finalized that suppliers achieving a rate of 90% will be offered an exemption from the required prior authorization. To determine supplier eligibility for continued exemption, the MACs would complete a post-payment medical review sample. From this sample, suppliers can meet a claim approval rate of 90% or greater to continue the exemption. And suppliers who do not meet the compliance rate must continue submitting the prior authorization requests.
Yeah, no, thanks for that overview.
Yeah. It's a little bit of good news.
We need all the good news we can get with the final rule, correct, Jennifer? And these days?
Oh my God. That's all I can say. This just is, it is a big rule. It's full of a lot of requirements, a lot of changes, but yeah, we'll take any grace we can get, in terms of the implementation.
Yeah, absolutely. And I know, Jennifer, your team, the quality team here at CHAP, is also really busy working on the changes that are also going to be implemented that impact your team as well as the accreditation team and suppliers. Both, what are some of the things that are impact, some of those items that are impacting your team, the quality team, and the accreditation process?
Well, certainly there's, the continued data submission that we do to CMS, about the accreditation surveys. There will be some increased data that we will need to report to CMS, and they're not forthcoming at the moment about what that extra data is going to look like, but certainly there will be more data that we will have to give them, and that's really in line with all of the oversight that they have finalized in this rule. So data submission, and we do have some changes with the complaint process. We will have to give information sooner and quicker about any complaints that are received about a supplier that we accredit. So we'll be making some process changes there. And of course, just getting ready for the volume of annual surveys. But as we said before, we do have a bit of a ramp up for that. So that's actually a blessing in disguise.
Yeah, absolutely. One of the elements that I identified that will be also an added workload, if you will, on the accreditation team, and ultimately the quality team and suppliers, is the requirement that if we accept a corrective action or request a corrective action plan in lieu of denying accreditation, then there needs to be a rationale from the AO as to the reason for the reason why a corrective action plan has been a permitted, if you will, accreditation with an action plan versus denial. So it sounds as though, CMS is really tightening up the, looking to see why and how DME providers and suppliers are being accredited, and if there is any trending there.
Yeah, absolutely. So that's going to be an important change for us. One thing that we can mention today, and I'm going to ask Shannon if she could weigh in on it, even though it's really not in the scope of what we do as an accreditation organization, but there were some changes to the competitive bidding program. And I don't know, Shannon, if you feel like you could give like the 50,000 foot highlight of the competitive bidding program changes.
Yeah, I mean, they obviously have added products, right? And they've added the new category of remote item delivery, which includes the CGMs, infusion pumps, and then, of course, your disposable supplies, ostomy, things of that nature. So, yeah, I think it's going to be important for all DME organizations, to really due diligence, right, and read this and understand the process, consult with industry experts, and be very purposeful in their strategic planning.
Yeah, absolutely. And thank you for that. So, Kim, we did mention AO changes on the horizon, right? So we have been approved as a DME provider since the beginning of the program. So we are going into some changes now, and hopefully you could talk about that, because I think as a DME provider / supplier, they have to be accredited, as you mentioned. So they really need to understand the accreditation parameters as they're going to change, as well as the parameters for them themselves. So could you give us some of the highlights of what our AOs are going to be required to do, or how it's going to look moving forward?
I can certainly start, and then Shannon, please feel free to jump in. I will also say that CMS indicated to all of us, all AOs on our call as well last week and on our individual calls, that this is an evolving process, both for us, for suppliers, as well as for CMS. So there are many, areas that we are moving forward with, and then will likely or hopefully receive some, further guidance moving forward with the survey process. But the survey process itself is really specific to each AO, and our standards do also meet the CMS, the DME quality standards. So that's what organizations are surveyed against. And it does depend on the type of supplier in terms of the focus of the survey. We also have not just DME posts, but we also have launched our infusion pharmacy service line, which also includes some limited DME. So that also, that's an area that is included. We will need to reapply for accreditate to be an approved deemed status provider for CMS, and that will come likely sometime in first quarter. We also, one of the things as a good news is, at least so far, is CMS is agreeing to continuing sampling. Sampling is used for larger providers. And this also was another area that I think AOs and suppliers are breathing a sigh of relief. Now, at the moment, we have been instructed that our current sampling methodology can be used, although we certainly can continue to evaluate that. And then we will await any further guidance, from CMS if there is any in the future. But it is, that was a welcome change, because the original proposed language, and when this was originally published, the final rule, there was a concern that, or before the final rule was published, there was a grave concern that all suppliers, all locations would need to be surveyed. Now, there does need to be a systematic way of reviewing organizations. But again, at this point, it's really up to each of the DME providers, the AOs, to make that determination. And CMS is going to be conducting validation surveys following AO surveys. It appears as though at the moment, from what we understand, that will be completed remotely. And if there is a need for CMS to go on site following an AO survey, I believe that there will be some communication that occurs with that. But again, that's an area that's also up for further discussion and development and evolvement, if that's a word. Shannon, do you have anything to add? I don't even know.
Yeah. No, that's good. It's always good that we make up words on the fly. I think the one thing to point out is change of location, right? If an organization has an address change, even if it's right across the street, what we were told is they draw a hard line when it comes to that. So we will be making site visits, for that change of address. So again, it's important for the organizations to be strategic, right, in their planning process and to know for what the next year is going to hold, because additional site visits are required.
And they have to be, as Jennifer pointed out, and in the final rule, they need to be approved with a site, with a survey, right?
Right.
For the change of location before it's not just a notification. And we know in other settings as well that there are sometimes delays, often, not sometimes, very often delays, not from the surveying entity, but from the processing, from CMS, and the MACs are part of that approval process. So I think it's a good point, Shannon, that, suppliers really need to think through operationally, what their plan is going to be in terms of any moves. And the other is looking at what locations that they currently have as both the suppliers and or warehouses. Is does that, because I guess my question to you, Shannon, is can you just explain how being designated as a warehouse impacts the the survey requirement?
Sure. So CMS requires that all service locations, that's the term that CMS uses, service locations, must be accredited, and of course, obviously require the PTAN. Warehouses can be extensions of, right, those service locations. So they don't necessarily require their own PTAN. However, some of the processes that are conducted at a warehouse location are what we would determine, whether we're doing a site visit or not to that particular warehouse. So for example, if a service location, meaning a location where patients can come, right, and pick up their equipment and receive instruction, maybe at that service location, they don't necessarily clean and repair equipment, but they do that at a warehouse that's a couple of miles down the road. That warehouse would be seen in conjunction with, right, that service center, because we obviously, part of the accreditation process is to review and assess compliance with infection control, repair and maintenance, and those standards as specified in the CMS quality standards. But you're right, to your point, again, organizations are going to be looking strategically, right, at whether or not these locations are going to continue to be service locations, whether some of them may be changed to a warehouse, or whether or not some of them can be eliminated. But again, that will go to their strategic planning process.
So as we sort of get to the end of our time here with our listeners, Kim and Shannon, what would you say to them? What are some takeaways? What are some pieces of advice you would give suppliers today on December 15th, knowing that the rule implements on January 1?
Yeah, absolutely. If I were a provider, I would be looking at my resources, right? I would be reaching out to, whether it's a national association, a state association, being sure that I do my homework, that I understand exactly what's required, and then sitting down with my team, right, to whether it's my budget, or looking at not only just the next year, but maybe even the next couple of years. Again, you got to be very strategic about this in order to ensure that you continue to provide quality services to your patients.
Excellent. Thanks, Shannon. Kim?
Yep. I mean, I wholeheartedly agree. And I'm also going to channel you, Jen, in our previous communication, and that is read the final rule. Read the final rule, listen to what any, industry webinars, state or national associations or experts, as well as certainly we have ourselves, in addition to this podcast. And we also have fabulous resources that, thank you, Jennifer, have been pulled together to summarize what the final rule key elements are and the direct impact on suppliers. Also, understand that These are, while everything is effective January 1st, 2026, there are some processes that will be evolving, both from CMS as well as from the AOs. So just staying in communication with, us, if you're accredited by CHOW or your AO, to ensure that you also understand those changes as well. So mostly staying ahead of what those, and knowing what those requirements are, and staying connected.
Excellent. Yes, and there are things out there for folks to read, but they got to read. They have to actually read the summaries and all of the different blogs that are out there. Well, thank you so much, Kim and Shannon, for laying out the ABCs of the DME provisions of this rule. Any final parting thoughts for our listeners?
No, just be knowledgeable, right? And, put your time and effort in and reach out for resources. Don't be afraid to reach out.
Yep, and strap on your safety belts. We're all going for a ride.
We're building the car as we're flying it or driving it. Flying
roller coaster that is
on the road, right?
Yeah.
Oh my gosh. Well, thanks so much to both of you. And thanks to all of you out there for taking time out of your day to listen to our DME podcast. So from Kim and Shannon and me and the entire CHOP staff, keep your quality needle moving forward, stay safe and well, and thanks for all you do.